Yay! Welcome.
Lee, that was harder than it should have been.
My computer wouldn't even load it, so I had to switch it to my phone. So
Yeah,
thank you for
I have
taking the
my
time.
iPad, so I thought it would be easier.
Right? Why would it be easy, right? Because it's something that we plan to do. So we have Dr. Vetter here. I'm Sarah, and I'm from the Health Foundation. And of course, Dr. Vetter is one of our recent additions as well. And we're here tonight to talk about the new laparoscopic tower that the foundation is raising money for, which you can see Dr. Vetter is super excited for. And you know, the way we're raising this money is through our upcoming gala. So normally the gala is in February, that everyone is familiar with. But this year we've decided with COVID that we are going to go bigger, because everyone, I think, is ready to come out and celebrate and raise money for good cause. So the Diamonds Are Forever James Bond themed gala is coming up on April 23rd, right? It's the 23rd.
Coming quick.
And we're actually moved to the PMM this year. So it definitely is going to be bigger and better. So enough of hearing from me. I'm going to turn it to Dr. Vetter just to kind of introduce herself, who you are, what you do here in Wainwright, and we'll kind of start getting into the nitty-gritty on what this lap tower does and what it's for. So, Dr. V.
Perfect. Thanks, Sarah. I'm Cheyenne Vetter. I think a few people in the community know me now. I have been here, it'll be 2 years in July. I'm a GP, but I actually did an extra year of surgical skills training. So medical training in Canada, we finish medical school, then we do a residency of our choice. My residency was in family medicine, and then I passed my family medicine exam, and then I decided I needed a bit more variety in my life. So then I went and I did another year of training. My extra year of training was 6 months of general surgery training and 6 months of obstetrics and gynecology training, which the entire point of that program is to give communities like ours access to some emergency procedures as well as some common procedures that are really nice to be able to do here instead of needing a trip to the city every time we have to do them. So that's my background. I actually grew up just south of here in the Hughenden area, graduated from HPS, and yeah, I'm happy to be back working at home.
Yeah. Everyone we talk to, they all love Dr. Vetter. But let's get to the nitty gritty of this lap tower, because we're hearing some people kind of like, you know, I don't know what this laparoscopic, what this tower is, what it does, why we need it. So if you could tell us, what is a laparoscopic tower and what type of procedures are currently done here using the current equipment? Okay.
Perfect. Well, a laparoscopic tower, the best way to think about it is really it being a system of equipment we use in the in the OR. The biggest portion of that, or what we call the tower portion of that, is what you see when you watch medical shows on TV, and they're doing surgery, and you see them put a camera into someone's abdomen and an image be up on the screen. So the screen part is what we consider the tower. Now that screen part is actually full of quite a few components. There are the screens, which are a very important part of it. But then there's also things like a CO2 insufflator that helps us inflate the abdomen to give us room to work. There is also a camera and a super high tech fiber optic light source, so we can get really bright light in the abdomen that won't burn any of the surrounding tissue or cause any damage. And then the other thing is that all of these towers give us the capabilities to take pictures. So whether that's within inside the abdomen, whether it's within inside the bowel when I'm doing colonoscopies or gastroscopies, or whether it's when I have a camera inside a uterus when I'm doing a hysteroscopy. So if you look at sort of a stereotypical lap tower, the most basic form of a lap tower is a tower that allows us to insufflate an abdomen with CO2 to be able to do laparoscopic surgeries. Laparoscopic surgeries are the ones where we don't have to do a big incision across your abdomen, but we can sometimes do 3 to 5 small little 1 to 2 centimeter incisions. The big benefits of laparoscopic surgery is that recovery time is much, much quicker than after an open surgery. You are pretty much always able to go home the same day you have surgery. And the other thing is it significantly improves post-operative pain. Right now, if we look at sort of the typical laparoscopic procedures we do some diagnostic laparoscopy, which is to go in and make a diagnosis based on what we can actually see with our own eyes once we're able to have a look around the abdomen. It is still better than CT or MRI. So that's really important. We do quite a few tubal ligations. Myself and Dr. Brills do those. And then I do a few emergency procedures as well. Things like bleeding ectopic pregnancy, which can actually be life-threatening. And then we're hoping that we upgrade our equipment here. I was trained to do appendectomies. So we're kind of hoping that eventually we'll be able to do those here as well. And then other possibilities is many people know we have surgeons who visit here, which this will really open the door for them to be able to do some bigger procedures that they have a longer wait list for. So this will give us the potential for the general surgeons to come, potentially be able to do gallbladders here, potentially be able to do laparoscopic hernia repairs here. And then also, if we ever are able to get a gynecologist to be able to do more advanced gynecology procedures. So those are kind of, when you think of stereotypical laparoscopic procedures, those are going to be sort of your bread and butter. That being said, the new system that we're getting is actually going to be used almost every day in our OR. I'm sure many of you have had the joy of hearing my bowel jokes when I do scopes. But essentially, I'm going to be able to use the screen on this system when we're doing endoscopy, which will actually give us the capability to hopefully eventually put our photos right in our endoscopy reports online. So that will be a really nice upgrade just to make communication better with specialists, and also to make communication and recall better between different endoscopists, and when I'm scoping someone from year to year to see if things have gotten better or worse. We also will be using this equipment for gynecologic procedures. So hysteroscopy is when I put a camera into the uterus, and then I can do microscopic procedures in the uterus, whether that's taking out polyps or fibroids, or just doing a good old diagnostic hysteroscopy to see what the heck is going on in there. So as a true laparoscopic tower, I would say we're using it for that, probably 1 or 2 days of the week. And then by using all of the components of it, we actually will use all of the components nearly every day. So it is a very welcome equipment upgrade, because my biggest fear is right now we're just babying the equipment we have. It's working just fine, but it is near the end of its life. And right now we know that if something goes wrong with our current system, it's actually not able to be replaced. It's too old. We would need an entire new system. So that is kind of the reasoning.
This equipment, yeah. So correct me if I'm wrong, like overarching, if it was, one phrase on what this equipment does, is it helps you see.
It helps you see. It helps you see. It gives us the big upgrade from year to year with this type of system is just like the TV in your house. So we're now at 4K screens, which improves the contrast we can see in tissue when we're operating. And it also helps to do things like minimize glare and stuff to make our image better. And also to allow us to capture that image is actually super important. Because as everyone knows, rarely is it one doctor involved in your care. And so the more pictures we can have, the better communication is.
And so again, this new tower is going to be compatible with Connect Care, right?
Yes. So that is the big thing. We're sort of, we want to get ahead of the curve. So we're ready when Connect Care comes. So it will allow any photos we take in the OR will be able to go onto the OR report, so that if we diagnose something like, say, severe endometriosis on a tubal procedure, we can easily document that on the chart and show proof. Same thing, if we're doing endoscopy, the hope is that this system will allow us to transition to be able to put photos in our reports.
Yeah, and for those that aren't aware of what Connect Care is, it is the new provincial EMR system. So kind of like it's what the doctors use to communicate and chart. Because right now everyone kind of uses their own systems. I think when I first got involved with Connect Care, they said there was over 1,300 individual systems being used in the province. And this one, essentially, you're going to be linking all of the AHS facilities. So if your procedure is done here and you have to go to Edmonton, eventually your chart follows you wherever you go, right? So I can see this being a great benefit, you know, like, you know, you don't have to have the same thing done more than once, right? The dream, when it rolls out across the province. So right now, how many procedures do you think you do in a month versus when we get the new tower to be used hopefully daily?
So right now, for like true bread and butter laparoscopic procedures, we're probably doing, I would say, like about 8 a month. Those are our bigger cases, so we usually only do 1 a day. For procedures that will use this equipment, we're doing like a ton. I'm in the OR six days a month, and so all 6 of those days this equipment will be used. And then the Lloydminster general surgeons who visit, I think, are usually in the OR 2 to 4 days a month, and it will be used on their days as well. So it'll be used quite a lot. Yeah.
It's funny. You caught me with poop jokes. Anyone that knows me knows I'm a lover of a good poop joke. What would your most memorable experience be using a lap tower?
Oh, my most memorable.
Without, you know, embarrassing.
Yeah, my most memorable experience is actually probably some of the ectopic pregnancies, just because it is very much one of the procedures where time matters. Blood loss can be pretty rapid, and with where we live, it could be rapid to the point there could be bad outcomes if we can't get it dealt with soon enough. So some of the best cases where I've been the surgeon myself have definitely been those cases where you're able to control bleeding and all of a sudden you can see everything. When you first go in there, it's all straight blood, and you find it, stop it, and then it looks like a normal abdomen after you're done. So I think for, procedures I do myself, that's probably the best memory. I definitely had a couple really good ones of those in my training. And then for procedures that I've assisted on, I was lucky through my training to get to assist some pretty amazing colorectal cancer surgeons on some phenomenal procedures they did laparoscopically. We won't be doing any of those in Wainwright, but it just goes to show sort of what the equipment can do.
Awesome. And you know, from a personal perspective, why do you think a lap tower is something important for the Health Foundation to fund?
I think it's really important for a few reasons. The first thing is to make sure that we maintain our current OR services in our community. I think it's really important for our community, and we don't want to take those for granted. Another thing is that if we ever want to expand our surgical program, it's important that we have the right equipment for surgeons to do their job. We have the right equipment now, but it's definitely a little bit dated. It was a big adjustment for me when I first got here, actually, to get used to working with the older equipment again. For me personally, the biggest thing is that picture and the fact and being able to clearly differentiate tissue and so on and so forth. The crisper the images, the better it is. And then the other reason why it's really important for our community is when we are looking at recruiting new physicians, new nurses, new medical staff, whether they're from the lab or they're part of the housekeeping team, the more diverse of services we're able to keep in a community, definitely the better place it is to work. So it's pretty awesome that we are able to have 24-hour emerge coverage, have many great family med clinics throughout town, have an OR program, and deliver babies. And I think that really makes us unique. And I'm really, really hopeful that will help us to grow, to be able to continue to serve our community.
Awesome. Well, I'm not going to take up any more of your time. We just want to say thank you for coming back home to practice medicine and for taking time away from your delivering babies to talk about this lap tower. And for anyone that wants to join us at the fundraising gala, the link for all the information is our website, which is wdchf.com. All the information on the Diamonds Are Forever Gala is up there, and where you can get tickets here in town. So thank you very much, and we can't wait to see you all dressed up in your snazzy black and white on April 23rd.
Yeah, we can't wait to see everyone.
Thanks for coming.
It's going to be fun.
Yeah, everyone I think needs a night out. So.
Yep, we all need to leave the house after a few years.
Right?
Bye, guys.
Have a good night.